Hi, my name is Elizabeth Perron, and today I'm going to be going over Chapter 17.4.2 with you. Specifically, it's the section over mental health in the late adulthood with Alzheimer's disease and other types of dementia. The section summary is just Alzheimer's and how they diagnose it, treat it, how it runs in a family, the other types of dementia I'll also go over with you, and then the difference in the rates of dementia in the US. Alzheimer's disease and other dementias. Alzheimer's disease is a neurocognitive disease. It's a very severe form of dementia. Alzheimer's can only be definitively identified with an autopsy or biopsy. So if somebody passes away and the family wants to have an autopsy done, they sure can to see. The mortician would the doctor would look at the brain to identify. They're looking for the tangles in the brain and the protein deposits to see if somebody has Alzheimer's. It can be hard to identify at first when people are having symptoms because many elderly people already complain of memory issues that are just normal with the aging process. And Alzheimer's is the #1 reason for institutionalization of elderly in the United States. A lot of family members can't afford to take work off and care for their elderly, which is really unfortunate. It's a huge responsibility to care for somebody like that, especially if they are a flight risk or there's many other things that could cause problems. There is treatment for it that can only help relieve the symptoms but never cure the disease. There is a drug called galantamine, and it increases the amount of neurotransmitters in the brain, and it appears to slow down the progression of Alzheimer's. Alzheimer's, after the initial diagnosis, can last anywhere from 9 to 12 years before it takes your loved one away from you. It's a very awful disease. They can also teach the person to use methods like making notes in a journal to remind themselves about people and what they look like, the medications that they need to take, the events that they have going on in their lives, or maybe some appointments that they need to make it to, and that helps with their quality of life. There are 2 categories of drugs. I am not going to try to pronounce them because I can't. But the first one that starts with a C boosts cell-to-cell communication in the brain by providing a neurotransmitter that is depleted in the brain by Alzheimer's. And then the second one slows the progression of the symptoms in people with Alzheimer's disease. And the other ways that they treat Alzheimer's is basically just treating the symptoms, so the behaviors, but they have to be really, they usually have problems sleeping, they get combative, so they'll treat those symptoms with things like melatonin, Lunesta, or Seroquel. There's many medications that help these people, but they have to be very careful not to over-medicate them. Otherwise, it can worsen their symptoms. They become more confused, more combative, or they become a high fall risk because they just have too much medication in their system. The other thing that they can do is change to a keto diet. There is actually, I posted the link right under my bullet at the bottom. It is a small, almost insignificant study that I found. They took 14 people with mild Alzheimer's and they changed them to a keto diet for 4 months. So only 10 of the 14 people actually made it to the end of the study. And then by the end of the study, 9 out of the 10 people showed significant cognitive changes, but they didn't have a control group, so they had nothing to compare them to. It does run in Alzheimer's is hereditary. However, they're not exactly sure how it works in families. The chromosome 19 plays a role. There is a protein called APOE that has been linked to Alzheimer's. And then there's other things that they found linked to that same protein, so they're not exactly sure. They haven't pinpointed how it's linked to Alzheimer's. families that have lots of Alzheimer's present in their family, there is a huge variability with the age of onset, the severity, the behaviors that it causes, and how long it takes to progress is just different with every single person. So they haven't found any patterns with that. These are just a few pictures. On the left of both pictures is a healthy, normal brain. On the right is the Alzheimer's affected brain. Basically, it blocks the neural pathways and it kills the nerve cells, which in the end ultimately just depletes the brain tissue, and your brain tissue ends up kind of looking like a sponge by the end of the disease. Dementia is really an umbrella term. It is a symptom and it's not a disease in itself. Some other types of dementia aside from Alzheimer's are vascular dementia, and that is when people have multiple small strokes and it causes the onset of dementia symptoms. But with lots of therapy, their quality of life can be improved. There's dementia with Lewy bodies. That is small proteins that get deposited into the brain nerve cells and ultimately cause them to die. It causes things like Parkinson's. And then there's frontotemporal dementia, and that is just referring to the part of the brain that the dementia affects. And this type of dementia really causes personality changes, and it's hard to watch. There are differences. There are a few odd things about the amount of people that show symptoms and how many people actually have Alzheimer's and what ages. 2 to 8% of adults older than 60 years of age worldwide show some type of symptoms of dementia. Studies suggest that 19% of adults between the ages of 75 to 84 in the US have Alzheimer's, and then when you hit 85, it more than doubles to 42% of the adults in the US have Alzheimer's. Alzheimer's is less prevalent in Africa but in the US is more prevalent in African Americans than white Americans, which I found very odd. And here are my references. So I hope you guys enjoyed my presentation and it wasn't too dry for you. Have a good day. Thank you for listening.